In this presentation, I am going to demonstrate how to insert a Foley catheter on a male patient. So let's begin by what we need. So we'll need a Foley catheter tray. I have an extra pair of gloves because I'm not very fond of the ones that come in the kit. It's always a good idea to even have another pair in your pocket in case you accidentally contaminate. We need a Velcro holder for the catheter once it's in place. We need supplies to do pericare, and then we need a bath blanket for draping. Okay? So entering the patient's room, I will wash my hands on the way in and greet the patient. Good morning, Mr. Blue Devil. The doctor has ordered that I put in a Foley catheter. This is a catheter that is going to go through your urethra and into your bladder. And once it's in your bladder, it's going to stay there and drain urine continuously so that we can measure and record and really keep a close eye on your urine output. Okay? Do you have any questions?
No.
Okay. I'm going to then just go into the chart and verify my order. And I see that I have an order on Mr. Blue Devil, Foley to continuous drainage for strict intake and output. And then I will verify identifiers. Mr. Blue Devil, can you please state your name and date of birth for me?
Yes, it's Duke Blue Devil 22282.
Okay, and yes. And I see there's no allergies to any of the antiseptic that I need to use for the procedure. So at this point then we're ready to get started. I will go ahead and provide for privacy. So just close the curtain, close the door, so that I can uphold very strict privacy for my patients. And before your catheter insertion, it's always a good idea to begin with Foley care with pericare so that we can be sure that the patient is nice and clean, that there's no flora on his skin that could potentially be inserted with the catheter insertion. So just a good place to start, especially if there's any fecal incontinence. Really just want to make sure that the patient is nice and clean before you get involved in the sterile part of the procedure. So I'm going to go ahead and get the bed up to a nice comfortable working height, and I will put some clean gloves on. I have some peri wipes here and a towel. I have a chucks, so I can put either my chucks or my towel down, whatever you prefer. And I'm just going to go ahead and let Mr. Blue Devil know that we're going to begin this process by cleaning him up in the private area here so that he's nice and clean before I start my procedure. Okay, and so put my towel down. And perform pericare. Okay, and I can use multiple wipes here. And so on and so forth. Okay, so we'll do very thorough pericare here. So again, he's nice and clean. Okay. Go ahead and dry. Put this on the side. And go ahead ahead and wash my hands. Okay. Cover him up. Okay, and so now we're ready to get him positioned and covered and draped for the procedure. So for a male, we want our male patients to be in a supine position, legs abducted. We're going to take the bed linen and we're going to bring it down to the lower part of the body, and we're just going to kind of mold it around the legs so we create a nice flat work surface for ourselves. Okay? And then we're going to use a bath blanket for warmth and for modesty. We're going to go ahead and put the bath blanket across the patient's upper body so he is covered here. Now I'm going to just leave him covered until I need to expose him, and then at that time I will go ahead and expose the genitalia. Okay? So it's always a good idea to wipe your table with an antimicrobial wipe before you get started with the sterile procedure. Actually, I am going to do this procedure because Mr. Blue Devil is alert and oriented and very cooperative. Then that gives me the option of doing this procedure, opening everything in the bed between the legs. And so with his permission, I'm going to go ahead and prepare my things in the bed. I will remind him not to move because any movement will compromise the sterility of my supplies in my field. So we've talked and he has agreed to be nice and still. And so I am going to then, rather than use my overbed table, for this demonstration I'm just going to show you this option, and that is opening your supplies in the bed, like so. Okay, the outer dust cover becomes a nice trash receptacle, but we have to make sure that we cuff it and create a nice big opening so that when we are ready to discard, we can aim and drop. So we never want to put our sterile hand inside the garbage can. My kid is about at the level of his ankles, and that's about where I want it positioned so that everything is where I need it to be for the insertion. Okay, first thing on the top of the kit are gloves, and I'm not ready for them yet, so I'm just going to pick them up and move them over. At this point, I need to expose the genitalia because my next step is going to be putting down some drapes. This particular kit gives me a nice folded edge. If I didn't have a folded edge, I would have to look for my 1-inch border, but this manufacturer has given me a little more latitude here. So, pick it up by that folded edge and then manage it by the 1-inch border. Being careful not to reach over my field as I put it down, so you'll notice I'm holding it from the upper border so that I'm not reaching over in this manner. I'm going to go ahead and lay that down. Okay? Now the next drape in my kit is a fenestrated drape, and that simply means it has a hole in it. And I do need to use the fenestrated drape on the male patient. On the female patient, it is optional. Now sometimes the fenestrated drape is packed in there very tightly and it's hard to know where that 1-inch border is. If that's the case, you can get your gloves on and then get in there and pick it up. But in this case, it was pretty easy to tell where my border was, so I'm going to just finish all my draping at this point. Okay, centering that opening over the penis, I'm going to go ahead and lay this down. All right? If I need to make some adjustments, I can, as long as I don't reach over top of my sterile surfaces here. Okay, so at this point, I'm ready for gloves. So the patient is draped, and it's time for me to get some gloves on so I can manage my supplies. Again, I am going to use my own gloves. that I brought in addition to the kit, and I'll use the kit's gloves as a backup if I should contaminate. Okay. Right. Okay, so now I have several things to do in order to prepare my supplies for the insertion. Namely, I have 4 things that I want to do. I want to open up my swab sticks and get those ready. I want to squirt some lubricant in the tray so that I can lubricate the catheter before insertion. I need to attach my syringe of water to my catheter's balloon port, and I need to remove the plastic sheath that is over top of my catheter. So we have those 4 things to do to prepare our kit before we get involved in the insertion. So I would open up my swabs, and some people just like to kind of pop them out a little bit like so. I like to take them out completely because sometimes they get a little stuck, and I don't want to be worried about that when I'm in the middle of the sterile procedure. My lubrication, and we will just simulate this in the nursing lab, but I will tear that open, and I'm going to squeeze it into one of the compartments here of my tray. Okay? So I'm just squeezing it in there. And then I have this protective sheath that is over top of my catheter. Now this is a little bit tricky because you want to make sure that you have good control of the catheter as you're taking that off. You don't want it to flop in a direction that could potentially contaminate it. And I'm going to go ahead and just rest that right in my lubricant that I put in that particular compartment. And then last but not least, I am going to attach, okay, I'm still okay, I'm on the sterile surface here, but I'm just going to bring this back in. Okay, and then I'm going to attach my syringe here. I have a specimen cup. I'm not going to worry about this. I could just ignore it or take it out and put it off to the side. Probably be better if you just ignore it. Okay, moment of pause, make sure everything's ready. I have my swabs, my lubrication, my water is on the balloon port. Okay, and the sleeve is off the catheter, so I'm ready to proceed. So I'm going to contaminate the non-dominant hand, and I will hold the penis by the shaft, and we need to hold the penis so that it is at a 90-degree angle to the body. And we're going to put just a slight traction, so gently pull up, just so, very slightly, just to straighten the urethra. And now I'm going to start to clean. When I clean, I just have to clean the glands. I don't have to go all the way down onto the shaft. So I start at the meatus, and then I spiral down to the base of the glands and discard. Swab 2, I do the same exact cleaning. Start at the meatus and spiral down. And swab number 3, back at the meatus and spiral down. So it's the same cleaning motion times 3. Okay? Alright, so now I'm ready to insert the catheter. I need to lubricate the catheter 5 to 7 inches. Controlling it, I'm going to just kind of get it moving out of the box there. And then I'm going to advance the catheter, and we'll let our patient know, Mr. Blue Devil, you're going to feel some pressure. I'm getting ready to insert the catheter. And he could take some deep breaths if that helps him to kind of relax. And so we advance the catheter. And we want to advance on the male patient. We want to advance 7 to 9 inches. And then as long as we have a nice pliable catheter, we can go ahead and further advance to the bifurcation. So the bifurcation is where the catheter kind of divides into two, you might say. So now if the catheter is rigid, we definitely don't want to advance to the bifurcation because we could potentially perforate the bladder. So use your judgment on that, but if we have a nice pliable catheter, we can advance to the bifurcation to be sure that the catheter is well in the bladder and that we are not going to run the risk of blowing up the balloon in the urethra, which would definitely traumatize and tear the urethra. So that is something to be very careful with, especially with the male. Okay, so you'll notice that I have taken my non-dominant hand and I reached down to stabilize the catheter, okay? So I want to make sure that while I'm turning my attention to blowing up the balloon, that the catheter doesn't slide out of the bladder and into the urethra. So that's why this is a critical element. We have to make sure that once it's inserted the distance that we want, that we reach down, we stabilize it, and then we're going to go ahead and inflate the balloon with our water. And this is what is going to anchor it in the bladder. There should not be any resistance. There should not be any outcries of pain or anything like that. Okay, holding thumb pressure on the syringe, otherwise the fluid will come back out, so we have to hold thumb pressure on the syringe. We're going to go ahead and we're going to pull the catheter back out, so this will pull the excess back out and it will seat the balloon at the neck of the bladder. And then, so we want to make sure that it is, secure, and then we will go ahead and remove the syringe. And with that step, the procedure, the sterile part of the procedure is done. So at this point, we would go ahead, if we need to change our gloves, we can certainly do that. So I'm going to take these gloves off, and then I'm going to go ahead and just put a clean pair of gloves on. And then I'm just going to finish the balance of the procedure here. So I need to, in the hospital, this would just be ripped right off, and I would clean up all of this draping. For our purposes in the lab, as you know, we use and reuse, so I'm just going to kind of ignore that and pretend that I've taken it off, but we would take all of our supplies and so forth and get them out of the way. And then the drainage bag needs to go on the bed frame, and we want to make sure that it is that the drainage tubing is in a straight line to the drainage bag, that we don't have any dependent loops, because dependent loops will cause urine to stagnate and it will shut our drainage down. So we want to make sure that we avoid that. And then last but not least, we will get our Velcro tube holder and we will secure it to the patient's leg. Okay, it's here somewhere. I know I had it. Aha. My short-term memory loss. I do have my tube holder. Okay. Oh dear. Okay, so tell Mr. Blue Devil he did a great job, and the worst part's over, that I'm just cleaning up and securing it. And this is an important part of the procedure because we don't want it to be tugging here where it can cause trauma to the tissues in the urethra and the bladder. Your Perry and Potter recommends for the patient who is confined to bed, we could do a securement device on the lower abdomen and direct the penis up toward the chest, and this position will take pressure off the penoscrotal angle. On the patient who is not confined to bed, that's not a very practical way to secure the catheter, so we would then just go ahead and secure it to the inner thigh like so, making sure that there's not tension on the catheter, that we have enough slack here for the patient to move his leg. But we definitely want to make sure that that is nice and secure. Okay, so that then concludes the procedure. Then we would just continue to clean up our space, and then we would put our patient back in a comfortable and safe position, and document the procedure and how he tolerated